So, hello, everybody, and I'm Dr. Goel, aka Dr. G, and I'm basic background is anesthesia and critical care, followed by internal medicine, and then functional and aesthetic medicine. And today, I'll be talking about hair restoration and how the modern innovations such as Energet and bioregenerative materials have completely reshaped the way we address hair restoration and regenerations in the current modern medicine. Most of my colleagues have eloquently described everything before me. Dr. Andikans, she mentioned about what is functional medicine, which I say should be the only way of doing medicine in current scenario by building a holistic, all integrated approach to target the problem. And as Ms. Audrey mentioned that, and she quoted one of my famous quote from Maya Angelou, that it is not what you say, and it's also not what you do, but it's what you make a person experience and feel. That's what they're going to remember forever. We heard about how PRP, PRF, and so many other bioregenerative materials can be used for different aesthetic and hair treatment methods, and the role of nutrition, hormone optimizations, advanced technologies such as genetic testing. So let's go together and pave a path for where the science, innovations, and humanity meets for a greater, brighter, and vibrant future for everyone. Hair restoration. I've been doing the hair restoration and regeneration for quite a while. And initially, the traditional ways of restoring hairs, like by doing topical solutions or by giving supplementations, oral supplementations. And then we started combining some of the bioregenerative materials like PRP, PRF, and lately exosomes, without realizing that not every PRP is same, not every exosome is same, and not every treatment which we think is the best runs for everyone, because the causes of hair fall is also different. What I like the most about the Energet is its comfortability for my patients. We just had this device few months ago in our practice, and you won't believe that every patient who is walking in getting a treatment from it, because it's a tool. Always remember, it is not what people gonna ask you for. It depends upon you how you can use this tool to give them what they want. I use Energet for every procedures, whether it's delivery of any compounding medications under the dermis, whether it's treating scars, hypertrophic scars, stretch marks, or whether it is for mesotherapy, even for hyperhidrosis. People, those who have a lot of submental and those jowls areas, I use it there as well. And my most favorite procedure is hair restoration. So how does Energet works? We're going to talk first about that, and then we're going to address hair restoration. So Energet, as you can see in this video, it has 3 different mechanism of action all happening at the same time and continues over next few months. release effect. As you can see, this technology uses high pressure jet, which inject any compounding solution or bioregenerative material or anything deep down up to 7 millimeter into the dermis and almost at the junction of reticular dermis and subdermal layer. And not just that, it causes lateralization and the spread of that medications up to 10 millimeter. Remodeling effect. As we all know that when it causes the lateralization of that compounding medication, it breaks all the fibroreceptor which are connecting the skin to the underlying subdermal layer, like in cases of scars, hypertrophic scars, keloid, and it breaks all of them. And that medications convert it into millions of nanoparticles, and it disperses thoroughly and in a way that it is so precise. I used to use microneedling devices, and I used to give injections by myself into the area which are most affected by alopecia. And every time I do it, we have to numb the patient a couple of times, sometimes a half an hour before the procedure. And even then, they still feel the pain. They still feel like, oh. And after that, doing a microneedling 2.5 millimeter deep is not fun. Since we have an jet, I'll just ask the patients, so would you like to have the same results and in fact better results without having any pain at all? And they'll be like, is it possible? I said, yeah, let's try it. And the only thing they heard is the noise. And they don't feel anything. They feel like somebody's just giving like when we do a Botox or something, it's like even the pain is like, most of my patients, they say their pain scale is 2 out of 10, which is like, for me, is a steal deal. Like 2 out of 10, they can't feel it even after an hour of numbing and using Pronox. So I wasn't done over there. So when they release it and when it causes this remodeling effect, is that when you break the collagen, as my previous colleague mentioned, that broken collagen act as a scaffolding where the new collagen synthesis happens over a period of time. The studies has shown that this device induces up to 80% more collagen synthesis than any of our traditional methods of microneedling or injections, which are not precise, the depth is not accurate always, and the spread of medication is also not accurate. And then happens a renew effect, which happens over a period of next following weeks and months, where that induces more collagen, elastin formation, and complete tissue regeneration. It doesn't only increase the growth of hair follicle or their restoration and regeneration, but also causes increased dermal thickening. Like a lot of my patients, while I was giving them the kinetic facelift, as I think Dr. Kainol mentioned, that she started noticing that they started having this hair growth up to 1 to 2 centimeter, where he was not even intending to do that for reasons. And you can see that I love this slide because this is actually what happens inside the dermis, which we do not see. But I love it how it goes, and it causes this a blab effect, like a TB Montus text you gave, and that is what makes the change. And none of my patients ever complain that after a day or so, they feel anything. Immediately they may feel it's something, but when you're doing in the scalp, they usually, scalp is an area where they have some hair growth and everything, and nobody notices them at all. The other thing is that how precise this device causes micro-injury and micro-trauma without causing much change in the epidermal layer. When we do the traditional injections or microneedling methods, we are literally ablating the epidermal layer from everywhere and then going to the dermal, reticular dermis, and the subdermal layers. But here, there is no change in the epidermal except this mic pinpoint bleeding kind of a thing, which I say that mosquito bite mimics. So why hair restoration is so important? About 80 million of people in America, both men and women, they suffer from some kind of hair loss. And there was a study published in which they say about 50% of white Caucasian males are suffering from male pattern baldness, or what I call is androgenic alopecia, as that is the most common cause of hair loss. Before I begin and go more into the details of how we can utilize Energet and all other bioregenerative material, I would like to focus that it is a holistic, integrated approach towards hair loss. As Dr. Keegan mentioned that your nutrition, your supplements, you need to find out what is the underlying cause of hair loss, because it's not going to be the same. Yes, we know that androgenic alopecia is the most common, but a lot of people, like one of my patients, she has habit of picking her hair, but we'll call it trichotillomania. And because of her anxiety, she picked so many hairs, she causes scarring, diffuse scarring all over her scalp. I decided to do this treatment on her. I'm still waiting for the results. I just did it last week. And she not just have this fullness, and she did not feel any pain, but her face lifted. And she was already excited because she got a facelift. She thinks that way. But how we can use, and I think Dr. Carroll mentioned that he initially uses just a simple normal saline to inject. And that's what I do. But followed by, if somebody has a lot of scarring, I use a little bit of exosomes and sometimes PRP. And PRF is one of my favorite recently. And followed by that, I do another pass with them. What it causes that first, it initially breaks those scar tissues, and then it causes dispersion of that bioregenerative material inside the dermis more diffusely and thoroughly. So what are the treatment options we have available with us for hair restoration or hair regeneration? Number one, the traditional methods such as topical solutions like minoxidil, finasteride, and there are so many other, ketoconazole, azelaic acid, and then oral supplements. A lot of time we give them low-dose finasteride, zinc, biotin, vitamin B, D, and other supplements so they can supplement not just the to improve the outcome of the procedure they get, but also to completely make a change in their lifestyle. Nutritional counseling is one of the most important things which in my practice, we always do. And what are those new innovative treatments? As I said, PRP, PRF, exosomes, growth factors, peptides, and there is a big future out there for the innovations of new upcoming bioregenerative materials. And I will talk a little bit about that at the end. Optimizing someone's hormones, understanding the reasons behind their hair loss. I had a patient, she was 68. She was going to a male hormone clinic where she was getting pellets after pellets. And a lot of those so-called functional medicine clinic, they do not understand that it is not about normalizing their hormones level or overshooting their hormones level for making them feel good is important, but optimizing their levels, which matches their lifestyle. But this industry can get dirty sometimes, and I see it all the time. And when we tested her testosterone levels, it was probably higher than mine, 700. I was like, damn, she's 68. No wonder she doesn't feel good in her own skin. And she was like, I can't sleep in the nights, my skin is so oily. But she was so brainwashed that she believed that she does need another pellet, another testosterone pellet, and she probably need a higher dose this time. She didn't believe what I was saying. So she went back, and she come back again a week later, because this time she went to an endocrinologist to confirm. And he exactly said the same thing, that who is doing this to you? I stopped her testosterone completely. I have to start her on finasteride, have to balance it with some progesterone and estrogen, because the only thing which exists in her body was testosterone. Everything else has gone down. And then I started treating her hairs. I'll show one of the pictures at the end of her before and after pictures. And one question people ask me a lot of time is that, what is the difference between PRP and PRF? PRP. PRP is your own blood. When we take someone's blood, we spin it in a centrifuge. There's so many different kind of centrifuge out there. How you separate, how you take the blood, whether you're using anticoagulants or not. And that depends upon the final concentration of platelets you will get. For hair restoration, I usually recommend having the platelet concentration which is 10 to 15 times higher than their concentration of platelet in their blood. Usually when we use a single tube, single spin, you don't get more than 4 to 5 times concentration, which is okay for aesthetic purposes like for skin and other things, but for hair we need at least 10 to 15 times. PRF, it's a fibrin matrix which releases the growth factors slowly over a period of time. And I use it BioPRF, and I think Claire has just started distributing BioPRF systems, and there's so many advantages of that. In fact, use it as a gel, as a filler as well, and by denaturating it with some heat, creating albumin, and then mixing with the rest of the PRF at the ratio of 1:2, and then creating that filler, which is so amazing. Results are so amazing when you do it under ice. You can even use it with this machine. You just have to mix it with some saline to decrease the viscosity of it, and then you will see amazing results. There are so many growth factors and peptides which we see in aesthetic community nowadays, and they are using it for hair restorations as well. I usually recommend my patients, those who are willing, to start on some of the peptides, which are kind of a sub-Q injections like BPC 157, TB 500, and GHPCQ, and they help in improving the cell-to-cell communication. As well, they are like a signaling pathway. They also causes release of some of the local and systemic hormones, which further helps in your tissue regeneration. There are so many local growth factors which PRP, PRF releases, such as fibroblast growth factors, epidermal growth factor, vascular endothelial growth factors, and IGF. We have, even when how the hair goes through the different stages of in its life cycle, from anagen, catagen to telogen, and how it goes back to the anagen phases, and in some people it doesn't go back. That depends upon the most important, which I found, is the communications between the dermal papillary cell and mesenchymal stem cells. The time duration during which a hair follicle stays in the anagen phase, it can vary from months to years. And then, for some reasons, in some people, because of their lifestyle, it enters into the catagen phase, which lasts for 2 to 3 weeks, when your hair follicles separate from the dermal papillary cells and causes miniaturizations and finally fall off during the telogen phase. When these communications between the dermal papillary cells, mesenchymal stem cells breaks because of any reasons, because of either they have a receptors for dihydrotestosterone, which causes androgenic alopecia, or because of their lifestyle, smoking, alcohol, drugs, nutritional deficiency, or by taking medications. There are tons of medications which causes hair fall. And most of the people, when they are taking it, they are not even aware of them. So going through each medications with that patient is very important. And finally, I'm a fan of Energat in a way that because I have used this system in practical every situation, whether as a mesotherapy tool, whether as a tool to deliver precise delivery of toxins for hyperhidrosis, or for dermal thickening, whether it's a TechNac, whether it is your post-acne scarring, hypertrophic scars, for keloids, and for hair restoration. The advantage is that it is so painless and comfortable, because at the end, it is the comfortability of the patient which counts. It's the experience which going to take from you. They're only going to remember how you made them feel again. If they go through all the pain and everything, they probably think twice or third time before coming for the second or third session. And how precisely it delivers the medications right where it's supposed to go, and the spread of the medications. You can use anything. I use PRP, PRF, exosome. Sometimes I combine things together, add some biotin in it, and it gives such amazing results. And this targeted delivery allows for deeper penetration and better absorptions for those compounding medications or bioregenerative material. And the results are very quicker and efficacious as compared to, like most of my patients, they see this lifting effect immediately, which they love. And after that follows their hair restoration and regeneration effects. And studies have shown that how high pressure technology can improve outcome and enhance the effectiveness by being more precise, effective, and comfortable. If you guys need any advice on how to use this device for multiple other ways to incorporate into your practice and for a better patient experience, don't hesitate to reach out to me today or tomorrow. I'll be here. Tomorrow I'll be talking about creating a monk-like focus for a better mindset, where you can not just make a change in your personal and professional, but in your practice as well. See you tomorrow, guys.